Hi, this is Winnie Anderson. I'm here with Dr. Patricia Rapici, a physical therapist currently practicing in Woodbine. She's my physical therapist, actually, and I've been grilling her about all things physical therapy and healing, and so I'm going to continue to ask her some questions. And Trish, one question that I think some people probably wrestle with is this issue of, let's face it, people don't exactly love to exercise. So there's this, I exercise for fitness, but then physical therapy involves some exercising, right? So what about the person who just doesn't like exercising, hates it, dreads it, and then has this thought that, well, now it's going to be painful if I have to go to physical therapy? How do you help people wrestle with that?
Well, the first thing is that you've got to be realistic. And it's just like, oh, I wish I could eat cheesecake. Well, cheesecake is going to make you gain weight. Exercise is involved in physical therapy to restore mobility. But, and if you're one of these people that wants to lay on the table and be passive, or think you can take a pill to get well, I'm sorry to tell you, it's just not going to work. There's no magic wand that's going to fix things. For example, a pill is going to help you, decrease your pain temporarily. It can help you decrease inflammation temporarily. But when you have injury, the injury causes, tissue shortening, tissue scarring. It causes loss of joint, mobility. You get stiff. You also get weakness, and a pill is not going to fix those things. And massage is going to make you feel better too for a little while, but you also have to think about being in charge and being realistic about keeping your mobility and also getting the most out of, the mobility that you can. You don't want to lose that, length, the tissue length. You don't want to lose your strength. You want to work on it. So, that being said, I don't, issue sheets of exercises to people that they can't do. We work together. I work with the patient's personality and their abilities and their tolerances. And sometimes it's just a matter of, I say to the patient, I'm going to give you what you can stand to do. And it's, oftentimes 6 exercises. I have that for a lot of patients who hate to exercise. And what, helps to reinforce them to be able to do the exercises and to come to terms with the reality that they should do them is they actually do feel better. And that's the point. You want to, understand that, this work that you're going to do is going to make you feel better. And it's really not going to be that hard.
Yeah, and it's almost counterintuitive, I think, that more movement is going to make you feel better. You would think that doing nothing, that will make me feel better, but it doesn't actually. So exercise and movement have many other health benefits,
Exactly.
Not just that I've got better mobility. So you want to talk about a couple of those?
Well, the exercise is proven to increase your strength, increase your flexibility. It also decreases inflammation and improves the metabolic function of the muscle. And unlike medications that have, bad side effects, exercise increases your mood, it increases your ability to think, it decreases depressive symptoms, so it has a lot of great side effects.
Yeah, and it's a great stress manager and stress reliever as well.
Yes.
Great information, thanks. So again, this has been Winnie Anderson with Dr. Patricia Rapici, physical therapist currently practicing in Woodbine. And if you'd like to get more information about how you can restore your mobility, manage your mobility, and fight aging, and use physical therapy to do all of that, you want to visit restoremobilitynow.com and get the additional information that Trish has for you there. Thanks.